So I think we'll get started. Dr. Bernstein asked me to introduce this morning's grand rounds. He's upstairs making rounds. So I'm not quite Dr. Bernstein this morning. Anyway, it's my pleasure to introduce two of our infamous or famous, which I don't know which one we would like to discuss, but Dr. Tara, and I always get her name and I'm nervous wrong, but it's Chobatuk, and Dr. Heather Flower. And so they're going to talk about Tap the Tap. So thank you very much for presenting, and welcome.
Good morning, everyone. So Heather and I would like to talk to you about Tap the Tap, evidence-based advocacy for healthy beverage choices in the community. So Heather and I do not have any disclosures to declare. We do like to drink sugary beverages on occasion, but we do definitely drink a lot of water. And we're very passionate about health advocacy and helping our patients make healthier choices. The objectives of our presentation is by the end of this lecture, we want you to be able to discuss evidence on the health impacts of beverage choices in children, discuss the key messages of Tap the Tap Community Health Advocacy Project, advocate for healthier beverage choices among your patients, and understand the value of a community-driven health advocacy project. We're going to start by testing your knowledge. Don't worry, we're not going to get you to put up your hands, but we'll get you to think about the answers. So our first question. According to the Loving Care series, children's daily juice intake should be limited to which volume? None, half a cup or less, 1 cup or less, or no limit. I'll give you a few seconds to think about your answer. So for those of you that chose B, a half cup or less, you're right. So for those of you who are unfamiliar with Loving Care, this is a series created by Nova Scotia's Department of Health and Wellness in partnership with Public Health Services. And after the birth of a baby in Nova Scotia, every new family receives this series, and it focuses on anticipatory guidance, including recommendations about nutrition. This page of Loving Care says your toddler does not need juice. If you decide to offer your child juice, give no more than a half a cup or 125 milliliters of fruit or vegetable juice per day. In contrast, the Canada Food Guide for Healthy Eating does not give a specific maximum amount, but does say have fruits and vegetables more often than juice, and counts a half cup of juice as a serving of fruits and vegetables. So on to our second question. Which health outcome in children has been linked to sugar-sweetened beverages in the literature? Is it A, overweight and obesity, B, dental caries, C, picky eating, D, A and B, or E, all of the above? Hearing a few answers out there. So the true answer is overweight and obesity and dental caries, so answer D. Although conceptually and anecdotally, sugar-sweetened beverages and picky eating seem related, this has actually not been well studied in the literature. And as you'll learn further in our presentation, there is evidence to support that intake of sugar-sweetened beverages is associated with obesity and overweight, and even stronger evidence to link sugar-sweetened beverages with dental caries. So on to our last question. Which famous person tweeted about drinking water? Is it Stephen Harper, Michelle Obama, Gwyneth Paltrow, or Dasani CEO? Hearing a few answers out there. So it is First Lady Michelle Obama. She has her FLOTUS, or First Lady of the US, Twitter account. And on September 26th, she tweeted, "Drinking more water is an easy choice that everyone can make." She is teamed up with Partnership for a Healthier America. That's a nonprofit organization that works with the private sector to try to solve the childhood obesity crisis. Their Drink Up campaign encourages everyone to drink more water. And Heather was actually listening to this on the news this morning, how there's some evidence to suggest that since she's been involved, that there may have been a slowing of the obesity epidemic. So it's very, very topical. There's been a lot of media about this topic recently. For those of you that chose the Dasani CEO as your answer, you may have heard that Dasani, which is the Coca-Cola company, was in the news a number of years ago when it was publicized that the company was actually selling Calgary's tap water. So I encourage all of you to save some money and just go for the tap instead. So I'm going to change gears for a minute and introduce our advocacy project. So I'd like to tell you first of all about the IWK Pediatrics Spryfield Clinic. And this clinic, as many of you might know, was started in January 2012. Heather initially started this clinic, and then 6 months later I took over as the pediatrician there. This clinic is located in the Community Wellness Center, and it strives to deliver care to those patients that need general pediatric consultation or follow-up. And patients either live in the Spryfield area or have a family physician that practices in this area. And as many of you know as well, Spryfield is a really unique and vibrant community, but it does have some challenges, including higher levels of single parents, visible minorities, school dropout, and unemployment than is average for HRM and Nova Scotia. So this map shows the postal codes of the catchment area, and it's also an income map with the paler colors being lower average income. And you can tell from this map that the areas of Spryfield have lower average income compared to some of the other areas in HRM. And this other picture is the outside of the Community Wellness Center. And this is also a site where the Chubukto Community Health Team practices, as well as Dalhousie Family Medicine site. To gain presence in the community, establish relationships, build trust among community members, and promote healthy living in the community, when Heather first started here, she felt it was very important to start a community advocacy project. And as part of her initial groundwork, Heather had discussions with staff at the Chubukto Family Center, which is the local family resource center, and Edward Yost Children's Center, which is the largest daycare center in Spryfield. And both of these groups identified preschooler nutrition as one of the key concerns among families in this area. So this then guided the entire direction of our health advocacy project. And from the beginning, the Tap the Tap initiative was a collaboration between multiple partners. And while Heather and I are going to be the ones standing here today telling you about it, this was most definitely a huge group effort. And on our team, we had IWK Primary Health, Chubukto Community Health Team, IWK Community Pediatrics, Capital Health Public Health Services, including a dietitian and a dental hygienist, Chubukto Family Center, Edward Yost Children's Center, and also JL Ilsley High School, which is one of the local high schools in the area. For those of you that are unfamiliar with IWK Primary Health, this is one of the branches of the IWK. They work as a collaborative partner as the Capital Health Community Health Teams, and they have health teams in Dartmouth and Preston in addition to Chubukto. One of the important things about our group is that we met regularly to divide up tasks and give each other updates, and we also all gave our unique perspectives, which I think really made this project a lot richer in the end. We chose a very basic message that we wanted to spread to preschool children and their families, and this was to drink tap water between meals to stay healthy. So I'm going to take a few moments to give you a little bit of insight into why we chose this message. And I'm going to show you some of the sugar content in some of the really popular beverages among children. So here's the number of grams of sugar per half cup or 125 mils of each beverage. So to start with, Coca-Cola has 14 grams of sugar. 100% unsweetened apple juice has 14 grams of sugar. You can also see with a cup and a bottle just how many sugar cubes there are, which is a lot. 2% chocolate milk has similar amount at 13 grams. Fruitopia has a whopping 29 grams of sugar per half cup. Gatorade has 7 grams. While that may not look bad, a typical bottle of Gatorade is actually 20 ounces. And so if a child's drinking a bottle of Gatorade, they're getting 5 times that amount of sugar. And for those of you that like to line up at Tim Hortons and get your iced cappuccinos per half cup, which is not a full serving, according to them, there's 13 grams of sugar. And obviously, water, in comparison, has 0 grams. So just how many of these beverages are children drinking? There was a Canadian health survey done in 2004, and when surveyed about juice consumption for children on their previous day, about 60% of children 1 to 3 years of age had consumed juice. So those are quite young children, and 60% had consumed juice. There's been 2 recent articles in the March 2014 issue of Journal of School Health. The first one was in children in Alabama, and they surveyed parents to see what kind of drinks their child, 3 to 5 years of age, were drinking. And 94% had consumed sweetened milk, so things like chocolate milk or strawberry milk or other milkshake type things. And 88% consumed fruity beverages on a fairly regular basis. The next one was teenagers, and this was a study conducted in Ontario and PEI. And when surveyed, 44% of this age group had consumed 3 or more sugar-sweetened beverages on the previous day. So that's quite a lot of intake. And finally, in 2011, Statistics Canada put out a report, and they said on average, children 1 to 18 years of age were consuming 100 to 170 grams of sugar per day in their diet, including beverages. And obviously, they're going to get some sugar from things like milk, which is appropriate. However, 25 to 30% of this sugar intake was from beverages other than milk. And that, in my opinion, should be closer to 0. So now that I've given you some information, I'm going to turn it over to Heather to review some of the recent literature on the health impacts of these beverages.
Good morning. It's nice to be here and finally share this project that has been such an exciting thing for all of us that have been involved to participate in. Is there a slide? Just waiting. There we go. So, a slide like this was always my cue to nod off. So when I'm sitting in your chair, so just know that I'm watching, and hopefully I can give you a little bit of information to take home. So the risk factors that are, this is to be memorized. The risk factors related to obesity in children are complex and totally interwoven, and we chose one factor to target, sugar-sweetened beverages, in one age group, preschoolers, because it related to the community needs and appeared at first glance to be pretty straightforward for a simple advocacy project. But as you can see from this web framework, it represents just a single factor in the midst of many. And the research available that I'm going to review with you sadly did not reach out to us and just hand us an answer, and always pitiful when that happens, but that's the way it is. So the frameworks and the literature that link the sugar-sweetened beverages and dental health issues are a little clearer. And as you can see by the slide, intuitively, it's not difficult to accept that link between poor nutrition, poor oral health, and obesity. It makes sense. And many institutions who are involved with child health accept these links and have as truths and have formulated policies based on them. And there's our little piece of that framework. So I'm going to review some of those policies first. So the CPS, Canadian Pediatric Society, as well as the American Academy of Pediatrics, have adopted policies around the intake of juice and for some sugar-sweetened beverages. So in 2013, CPS tells us that babies and children do not need to drink juice. But if you're going to offer juice, it should be 100% fruit juice. It should be in a cup as part of a meal or snack. And that's really an important piece here, not between meals, sipping as you're wandering around the house or outside. And limit to 4 to 6 ounces daily. That's sippy cups can get pretty big, but in the regular size, that's 1 sippy cup a day. And they state clearly that too much juice can cause early tooth decay. The American Academy of Pediatrics in 2001, they actually go a little bit further and are more specific in their guidelines. So they say to avoid serving juice to older infants and toddlers in bottles to consume through the day. These are paraphrased. Avoid giving fruit juice at bedtime. No juice in age under 6 months. 4 to 6 ounce daily limits in ages 1 to 6, which is our target group. And 8 to 12 ounces daily in the 7 to 18-year-olds. And as you heard from Tara's review, it's generally much larger consumption than that. And to encourage whole fruits. The Nova Scotia Public Schools in 2006 and the Nova Scotia licensed childcare centres also have policies. The Nova Scotia Public Schools eliminates, except for special functions, pop and sugar-sweetened beverages, but does allow 100% juice. Water is encouraged, or is to be encouraged, but sadly the monitoring amongst the public schools is not done very stringently, and it's really left up to the efforts of the individual principals to maintain those. In contrast, the Nova Scotia licensed childcare centres have eliminated all sugar-sweetened beverages. They limit juice, 100% juice, to half a cup twice weekly, and it is well monitored. So most of them are using water. Thrive Nova Scotia. I don't know how much you know about that, but it's a provincial initiative started in 2012, aimed at childhood obesity prevention strategies, and it aims at providing opportunities and building capacity in the community to offer healthier food and activity choices. One of their programs that you may have heard of is the Back to Play program. They're less directive in their policy around beverages. They have more general goals and identified actions, working with institutions to develop their own healthy food policies. And in conjunction with Thrive's goals, the Department of Health and Wellness and the various DHAs, including the IWK, are currently working toward a provincial healthy eating policy for all the institutions involved. Tara pointed out earlier the Loving Care books, and this is, as she said, an initiative of the Nova Scotia Department of Health and Wellness in partnership with Public Health. These books are truly wonderful, and really until I knew they existed, but until doing this project I really hadn't read them thoroughly. They have so much amazing information, and I think we need to be promoting them more and using them more. They're online and available and can be used for handouts too. But what they're saying, is it readable? Yeah. Again, the water should be encouraged. Offer tap water when your child is thirsty. They have a statement about juice, which we've gone over already. And they also talk about the issues of juice intake and tooth decay. But what's the evidence for these policies and for our intervention? So the only evidence that I could find that even had the word Cochrane in it was a meta-analysis of 37 studies, including 27,000, almost 28,000 children. The 0 to 5-year-old subgroup really didn't reach any statistical significance in this. So keep in mind, as I'm talking about it, that it's not generalizable to our population. But they looked in these articles for articles around interventions that would prevent obesity in children. And there was a great heterogeneity amongst these interventions. It was the clean out the fridge approach. So there were physical activity interventions, there were healthy food in schools, everything that you can imagine. And so the knowledge translation to practice is difficult. And we certainly can't take from it that you can specify the beverage choice interventions as being strongly significant. The U.S. Department of Education did a study, prospective birth cohort of 10,700 children who were born in 2001 and then followed longitudinally at 9 months, 2, 4, and 5 years of age. And they looked at the data in terms of the self-reported parent data for beverage consumption in the children. And they coded it so that regular drinkers of sugar-sweetened beverages were defined as any child drinking more than or equal to one sugar-sweetened beverage in a day, and non-drinkers less than one serving a day. And then they followed them with standardized weights and heights over those four follow-up times. And what they found was, and this is busy, but I'll bring it into perspective for you. So they looked at overweight and obesity at the 2-year, 4-year, and 5-year mark, and the odds ratios related to the sugar-sweetened intake, sugar-sweetened beverage intake. So what they found, there was no change at all at 2 years of age. But once they got to the 4-year mark, there were increased odds of overweight in the 4 and 5-year-olds. More so in the ones that, in the models, the regression models that were not adjusted for things like gender, race, ethnicity, socioeconomic status, mothers, BMI, etc. As you can see in the greens, the odds ratios are crossing 0. But they did find a clear indication of increased odds of obesity, mostly in the 5-year-old group, in those who had regular sugar-sweetened beverages. So that was a good study, providing us with some decent information. In urban Amsterdam, they tried an RCT of sugar-free or sugar-sweetened beverages looking at weight in children. And to get away from the parent report data, they actually delivered randomly a sugar-sweetened beverage or a sugar-free beverage to normal weight children aged 4 to 11 on a daily basis over an 18-month period, and watched their weight gain and BMI Z scores. By the end of the study, you should know that 26% of the kids had stopped drinking the beverages. Some of them said they knew what they were getting and they weren't going forward with this. So, but they imputed that, is that the right word? Imputed that data into their results. And even with that, there were significantly less weight gain and less increases in BMI Z scores at 18 months in the sugar-free group. So another reasonable study. The data for dental caries and sugar-free drinks or sugar-sweetened beverages is even clearer. So this is a prospective birth cohort study where the background, it was actually a protocol that's been published, but the background information provided in the study was very interesting. So this was data from two sources, the state of Victoria, both in Australia. The state of Victoria, they have an interesting concept that they call ACSCs, which is ambulatory care sensitive conditions. And what they mean by that is they're looking at hospital admissions that they feel could be avoided if ambulatory management and preventive strategies were used well. And particularly looking at the sugar-sweetened beverages in this particular study. What they found was that dental caries and childhood obesity have common diet-related risk factors, particularly with the sugar-sweetened beverages. And children from the rural areas were 3 times more likely to be admitted for dental care. And 50% of those rural children were not drinking tap water. Now, they postulated why that might be. You know, Australia has a very different climate than we do in many ways. And they felt that the parent perception of water safety in these rural areas may be in question due to the drought and also fluoridation of the water. The parents weren't happy with the choice of fluoridation. Another Australian study from Queensland this time, a logistic regression looking at soft drink consumption and primary tooth extraction. So data from child health surveys in 2003 and 2008. For both years, the odds of tooth extraction increased with every can of soft drink consumed. Again, self-report data. Soft drinks that were consumed between meals increased the odds of tooth extraction 3 to 4 times. And they did notice happily a significant decrease in soft drink consumption in 2008 compared with 2003. In Iowa, there was a secondary data analysis of 156 children. They were recruited from 8 Iowa postpartum units in 1992 to 1995, and dental exams were done at 5, 9, and 13 years. The protective factors found from the regression analysis were higher socioeconomic status, not surprising, more frequent toothbrushing, not surprising. Surprising was increased 100% fruit juice consumption as a protective factor. The authors went on to postulate why that might be, and it was certainly puzzling. They feel that it may have been associated with other healthier food choices, that children who were not drinking 100% fruit juice were drinking larger amounts of other sugar-sweetened beverages. It may have some potentially protective effect, not yet determined, but definitely probably some confounding variables involved. I found 2 articles partially funded by the Juice Products Association in the United States. They're the same data source and one common author between the two, who found no association between 100% juice intake and overweight in children 2 to 10 years of age. And neither of these articles addressed dental caries, and both were asking for revisions to the statements. So what can we safely conclude? Well, I think we can conclude that we should encourage water. Well, I knew that was going to happen. Encourage water for thirst between meals. Discourage sugar-sweetened beverages in our patients and their families. Encourage fruits and vegetables instead of juice. Discourage continuous sipping of any sweetened beverage, including milk. And I think that this is one of the biggest culprits. We as adults are terrible role models in this. We run around with our tea and coffee sippy cups all day long, and the children do as well. And they're constantly bathing their teeth and filling their tummies with empty calories. We need to advocate for policies to optimize healthy beverage choices in any institution used by children. And we need to be emphasizing these strategies preventively very early on, starting in NICU, starting in family physician offices, starting everywhere where parents are having children, because if we can set the healthy strategies early, we're going to be ahead of the game later. We also need to reiterate what's in the Loving Care book with parents and their families. And we need to drink tap water between meals to stay healthy. Back to Tara.
So hopefully this gives you some insight into why we chose to give this message. And we wanted to promote tap water, especially because it's healthy, it's accessible, and it's inexpensive. Water in the HRM has the added benefit of fluoride to prevent dental decay. Bottled water may or may not be fluoridated, and so it may not have the recommended intake of fluoride to have the same level of protection for dental caries. This is the front and back side of the information card that we created for families. The front side contains our key messages, and the back side elaborates with a bit more information for people who want to explore beyond the basic messages. Creating these key messages was a lot more difficult than we anticipated. We thought it would be pretty easy, but we wanted something that was simple, clear message. We wanted to target preschool children and families and make it really appealing to them. And we also needed it to be consistent with our Provincial Loving Care series and the other messages that are out there, and also at the correct literacy level. So as you can imagine, we went through a bunch of iterations to get to where we got it to, and this information card is now part of the IWK repertoire. So our information card emphasizes that between meals, water is the best drink for children. Children do not need juice or sugar-sweetened drinks. These can lead to obesity, poor nutrition, and tooth decay. Even 100% fruit juice should be limited. Offer your child whole fruits and vegetables instead. Preschool children only need 2 cups of milk per day for healthy bones and teeth. And I find in the office this really surprises parents a lot because they've been taught to really push the milk. Healthy children 12 months and older should be drinking out of an open cup, and putting only water in sippy cups and bottles will help to avoid tooth decay. And drinking tap water will save your family money. By collaborating together, this project really strengthened relationships between all of our groups, and we learned so much from each other. Here are some testimonials from some of our collaborators. Kira Kelly, parenting counselor at Chibukto Family Center, said, "Through participating in the Tap the Tap community health advocacy project, I feel much more connected with a variety of health professionals. I now have a better understanding of who is offering what, different research and trends in healthcare, as well as an enhanced ability to refer service users to a professional who I know and respect. I am now better equipped to do informal consults and advocate on behalf of families using the Chibukto Family Center." And Jackie Spears, the manager of primary health, said, "The Tap project gave IWK Primary Health the opportunity to build closer relationships with the IWK community pediatricians and our community, and to learn how we can work together to support children, youth, and families. As members of the Chibukto community health team, we often worked with this community, but having the community pediatric model in place added a whole new dimension to this work." We felt it was very important to engage the community in this health initiative. So you heard right from the beginning, we went to them and looked to them for what they wanted health advocacy on, and they really influenced the initial direction for the health advocacy initiative. We also held a number of parent brainstorming sessions in the community. Initially, we wanted to know how they felt we could best get this information out. We're actually quite surprised by the results. We thought they were going to be wanting to use Twitter and Facebook and all this, and they actually said that they wanted an information card. We also got their perspectives on how we could do a fun launch event and have a family fun event to give our information. And we also went to them asking them how they felt we could evaluate our success for this project in the community. We also had the JL Ilsley High School students involved in a number of steps, and we felt it was really important to engage them in the initiative and get their input and have them feel connected to this. So we went to the art class and asked them to hold a little contest to design a mascot for us. And this is Tapman and Super Squirt. So Jessica Jackson and Mary Margaret Bennett are the high school students who designed these two mascots. We then went to the company Ray of Halifax, who designs mascots, who turned their original sketches into these guys, and then created life-size mascots for us. You'll see them in a little bit. We also asked the music class to help us prepare a music jingle that would be appealing to children. And really with the art class and the music class, we thought that they would probably know better than us at how to engage preschool children and get them excited about this message. We also asked the film class to produce a little video for us, and they did some filming at the local daycare and produced a video for us. And we also had volunteers from the high school students helping out at our launch event. So lots of involvement. We teamed up with the Spryfield Area Family Support Task Force, who puts on a very popular event called the Book Bonanza, where they give out a bunch of free books to families, and it's a well-established event in the community. And so we actually had our event tag onto them and do it at the same day, because we knew that we would have access to a lot of families to spread our message. And when it came to our evaluation, which I'll discuss a little bit more in a minute, we used a number of community sites to collect information. So I'd like to show you an abbreviated clip from the video that the JL Ilsley High School students and their film teacher, Alistair Duncan, created after videoing the preschoolers at Edward Yost Children's Centre. So here's Tapman and Super Squirt, and they're like a full life-size version. So we'll bring these guys out a little bit later too. You can see them up close. So in May 2013, we had a Tap the Tap family fun event at the Captain William Spry Center, where we teamed up with the Book Bonanza. It was a very well-attended event. We reached an estimated 250 families, which we were very happy about. We gave out about 350 water bottles with our message to Tap the Tap, and that was thanks to sponsoring by Halifax Water Commission. We gave out information cards to parents. We had lots of fun activities for the kids, and we also had a lot of educational booths, including one on just how much sugar is in each of the sugary beverages, and I think that was one of the things that was best received by families. Ann Cogden, our former executive of primary health, gave some welcoming comments, and of course our mascots, Tapman and Super Skirt, were there to join in the fun. And since then, we have also had Tap the Tap events in Dartmouth and at the IWK as well. And more about these events and the details of that can be found on the IWK website if you're interested in hearing more. As you can imagine, direct evaluation of the impacts of any health initiative is pretty difficult to measure. And so we had asked the community how they thought we could evaluate our success of this project. What they recommended was that we do not do any formal questionnaires or get informed consent, because they thought that people would not be interested in participating. Instead, they recommended that we gather information by using unmanned ballot boxes that we would set up throughout the community, where people could check off their answers to our questions and decide to participate or not in a very non-pressured way. So we had 4 questions and tear-off pads where they could check their answers. And we also had a draw for a prize to help encourage participation, which was swim lessons at the local Captain Williams Fry Center. So our questions were the following. Between meals, which drink is best for your child's health? How much milk does a child 2 to 8 years old need to drink each day? On average, how much juice does your child drink each day? And true or false, if your child is a picky eater, you should offer more fruit juice for extra nutrition. So with these questions, we were trying to capture both knowledge and behavior. Again, we thought it'd be pretty simple coming up with some questions, and this actually took a lot of thought, a lot of word changes. So these ballot boxes were strategically placed in 5 locations throughout Spryfield to target young families. And we collected answers before our family fun event and then afterwards as well. We also had graphic facilitator Corey Melanson document our process. And she attended one of our parent brainstorming sessions where we were asking questions about how we could evaluate the success of our project. And she also attended our launch event and interacted with the families there. And this is one of the pieces that she created as a visual evaluation of our launch event with input from our families. We also got a lot of media attention on a few occasions. So I was on Global TV, the morning show in May, and CBC Radio Information Morning in November. And our project was featured on the Canadian Pediatric Society blog in January. In terms of other outcomes from this project, so as I've mentioned, we have built strong relationships between IWK Primary Health community groups, the community members, and Heather and I, which we hope in turn will benefit our patients and their communities. And since Tap the Tap, IWK Primary Health and I have already collaborated on a couple of other projects, including a session called Toddlers at the Table that was targeting families in Spryfield and giving healthy eating tips to those really picky toddlers and their parents, and in another health and wellness series that will go on in the future. We also have influenced some juice-free policies. So there was a barbecue in Dartmouth that used to include a lot of sugary beverages, but they decided to go juice and sugar-free because of our involvement. And we've recruited Buddington to help spread our message. And so Buddington is going to the dentist, Dr. Anderson, in this video. And there's some IWK YouTube videos with Buddington. And also those new IWK gallery screens have our message to Tap the Tap. We hope that we've also increased healthcare provider awareness for counseling patients. And one of the biggest outcomes that I think will be very sustainable in the future is the Tap the Tap Water Between Meals Toolkit. So this is our health advocacy toolkit. It's posted on the IWK website under the primary health tab and under their Healthy Habits, Healthy Families section. This has an information section for families, which has our information card, and it also has a free toolkit for community organizations to use for whatever purposes they want. So there's our information card, there's a family fun event template, there's an evaluation form, and information about past Tap the Tap events to try to get them inspired. And we're already trying to develop a policy for how to rent the mascots, because obviously those are really fun to include in an event too. And so far, Crystal Daycare Center in Dartmouth has already used our material to throw their own events where they reached out to 25 preschoolers, and they gave a very positive evaluation, and they felt that they had all the necessary materials to give a successful event on Tap the Tap. And as well, in that CPS blog, they have a link to our toolkit as well. So while it's been a lot of fun, we also have had some challenges along the way. So the evaluation piece was something that we found especially tricky. As I touched on, there is a lack of public willingness to participate in formal research, and so that really limited the kind of questions that we could ask and the information that we could get out of the evaluation. Also, when relying on caregiver retrospective reporting, there may be some inaccuracies. For example, parents might perceive that their children aren't drinking a lot of juice, but in reality, they are drinking quite a bit more than they might realize, or maybe even vice versa. And unfortunately, our ballot boxes didn't show significant results. So we had a lot of participation prior to our event and got quite a bit of information. However, after our event, the participation wasn't quite as high, and we weren't able to demonstrate a significant change in knowledge or behavior. With the focus of our health advocacy project, we wanted to target preschoolers because really that's what the community said that they wanted. And so that was great, but if we do try to bring this forward to other age groups, we'll probably have to design the campaign a little bit different because it wouldn't be quite as appealing to youth. And there's probably some difficulty generalizing this given public mistrust in tap water. There are concerns that some people have about the safety about tap water and whether it may be contaminated. And there's been a lot of news about anti-fluoridation opinions lately, and that could affect the generalizability as well. And given that we've now had some of our core Tap the Tap events, we're going to be relying on our partners through the Tap the Tap toolkit to further get the message out, which we think is great, but it also gives us a little less control overall about who's giving the message and how they're going to deliver that. So we already thought of different directions of where we can bring Tap the Tap next. So we will be mailing out letters as invitations to other health organizations to let them know about our toolkit and encourage them to use our materials and perhaps even throw their own Tap the Tap event. We will be promoting this internally at the IWK through things like Pulse and to the primary health teams, to dentistry, and to clinical nutrition. But we're also going to be promoting this widely outside of the IWK. And we're going to be teaming up with Doctors Nova Scotia, the Primary Health Care Network, Public Health Nutrition, Nova Scotia Dental Association, and College of Dental Hygienists of Nova Scotia, and District Department of Family Practice, as well as the licensed childcare facilities in Capital Health District, and try to spread this message further. One thing that I'm extremely excited about is that we've teamed up with Carrie Copeland from Doctors Nova Scotia, and Doctors Nova Scotia sponsors the Blue Nose Youth Run, and they have agreed to give our information card out in their youth race kits. So now our information card is going to be available to over 4,000 youth who run in the Blue Nose Doctors Nova Scotia Youth Race. So I'm very, very excited about that. Another thing that we're in the process of doing is a letter to the Blue Nose encouraging them to be juice and sugar sweetened beverage free at their youth race. We're also hoping to collaborate with CPS further and perhaps get more permanent links up to our toolkit on their main website. We're probably hoping at some point to write some of this down and submit an article to a journal. And hopefully we'd like to present some of this information at future conferences as well. And there's going to be continued messaging through the IWK primary health team. So I think sometimes as healthcare providers, we forget just how influential we can be on a day-to-day basis when we counsel our patients. And so I encourage all of you to think about counseling your patients on healthy beverage choices and the health impacts of drinking sugary beverages. Some of the ways that you can help your patients include promoting awareness. And so Heather and I have found that sometimes families just aren't aware about what children should be drinking. Some analogies or some ways that I like to present this information to families is I like to tell them that it takes sort of about 2 to 4 pieces of fruit to get a cup of 100% fruit juice. And so normally people probably wouldn't be giving their child quite a big snack and then 2 to 4 pieces of oranges or apples as well. And so I like to put that into context and say if they're drinking a full cup of fruit juice and having a big snack as well, they're probably getting too many calories overall. And as well, as Heather had alluded to before, one thing that I picked up for her is she likes to give the analogy that when children are constantly sipping on juice out of a sippy cup or a water bottle, that their teeth are constantly in a bath of sugar, and this is the perfect climate to promote dental cavities. Often we have families saying, well, I'd really like to cut down on the amount of sugary beverage that my child drinks, but they go to the fridge, they help themselves, or, they throw a big temper tantrum if they can't get their juice. So we do have some tips on having parents cut down on the sugary intake for their children. So we suggest putting only water in sippy cups and water bottles, and children can have free access to that throughout the day to drink water. They could buy smaller cups and only put juice or other sugar-sweetened beverages into the smaller cups, so maybe the children won't notice that they're having smaller portion sizes overall. We can recommend to gradually water down juice until children are more comfortable drinking something less sweet. And my favorite is to tell them not to buy the sugar-sweetened beverages or juice. Parents should be in control. They're the ones going to the grocery store. And they're going to save a lot of money if they don't buy these types of things. And if it's not in the household, it's not going to be as much of a fight, because if it's just not available, sorry, it's not available. You can drink water instead. So to put some fuel on the fire and encourage you to counsel your patients, I'm going to tell you what we're up against. So Coca-Cola launched a Cap the Tap program where they teach restaurant wait staff selling techniques on how to convert requests for tap water into orders for revenue-generating sugar-sweetened beverages. And in 2013, Gatorade released a game featuring a cartoon of Olympic champion Usain Bolt running through a course where he's hit by water and that slows him down, and by collecting Gatorade, he goes faster. That's what we're up against, guys. So in summary, recent literature supports that beverage choices impact children's health status. Tap the Tap is a community health advocacy project spreading the message to drink tap water in between meals to stay healthy. Counseling our patients on healthy beverage choices is easy, fast, and absolutely necessary. It has the potential to make a very large positive impact. And community-driven health advocacy projects strengthen collaborative relationships. So before we move on to questions, I'd like to play you a jingle and invite Tapman and Super Squirt to come on back and make another appearance. Oops, hang on. So a very big thank you to Tapman and Super Squirt, and I'd also like to thank all the people who were involved in Tap the Tap. There were so many people, it's going to take me forever to list them by name, so I won't, but I would like to give a huge thank you to everyone who is involved in this project. And we've got a number of people in the audience today from our Tap the Tap working group, so I'd like you guys to please stand so we can recognize your efforts. So hopefully we've been able to convey some of the passion that we have for this project. I would encourage you all to rethink your drink. We have some water available, so please feel free to fill up after we take questions. And as well, we have a number of water bottles that are available, so especially anybody with children, please feel free to grab one. We have some other information back there, our information cards and tattoos, stickers, that sort of thing. So I'd love to call Heather up here, and we would love to hear your comments or take any questions now.
So we'll just ask if there's any questions from any outside locations first. Okay, once again, we have a microphone full of questions. Just raise your hand and I'll bring it around. Just 1 second here.
Hi, thanks so much. That's a great presentation. I hadn't known that this was happening. Maybe I'm completely in the dark. When I was growing up, but I'm usually out in the dark. When I was growing up, we grew up in England on squash. I don't know whether you had squash, but essentially it was sort of that much at the bottom of a glass with that much tap water. And it was quite interesting because this is a little story. As my son was getting older and he was getting a bit chubby, that was the middle one, and I thought he was drinking a lot of juice. Juice was sort of available 21 years ago, and that was, you could afford it. It was, real juice, real fruit juice. And so we started to dilute it. Now he has that much apple juice and that much, and he still does that. And when I speak to my parents, one of the things I do, and I've noticed a lot of them coming in with water, and water, and I congratulate, they don't understand what I say, you're drinking water, and I congratulate them, and I think that's one of the things that, I've been teaching the students, congratulate the parent with the child drinking water. But the other thing I've noticed is the bottles are getting huge. So when you say a cup of milk, sometimes, that sippy cup of milk. That sippy cup has gone like gigantic, enormous sippy cup. So one of the things that I noticed you did have, they were smaller cups. And it's I've been noticing how the little cups, I've got little cups at home that I dish out sometimes when the toddler comes round, and they're tiny, and they're just non-existent anymore. So maybe I'm working on those cups, could be, because they have more than a cup of anything in there. And even I thought your little bottles are great, because they're little bottles, actually. And I go to still work on water rather than water.
Thanks, Sarah. That was great. I think you mentioned briefly about targeting the childcare centers in HRM, because a lot of the daycares are still offering juice. How are you going to go about communicating with them and getting that message?
Great question. So with the letters that we're going to send out, we're going to send information about our toolkit and hopefully encourage the different daycares to access that. And hopefully with the policies in place, they are limiting the juice intake to no more than what would be recommended with the twice per week.
Yeah, I'm interested in your comment because the licensed daycares, Nova Scotia licensed daycares, are supposedly not.
So Dalhousie gives juice at every meal.
Excellent.
So we'll be getting a separate letter.
And any other spies out there?
It's actually really hard to get water. You have to specifically ask, and they'll keep asking you every 6 months, are you sure you want your child to drink water?
Oh, this is great.
I'm just saying that would be a really good target.
Great target.
Families are getting that message.
Well, in Dalhousie, okay.
Noted. Thank you.
So thanks for a great presentation. What I find when I've been trying to counsel families about not drinking juice or sweetened beverages between meals, the comeback is often, but my child won't drink water. And I think a lot of this goes back to what I understand was basically started by bottled water companies, but is now on so many health-related websites saying that adults need to drink 8 glasses of water a day, and there's no evidence for this statement. And the water and tea doesn't count, the water and juice doesn't count. You have to drink water, not use bottled water. So I guess I'm wondering if you found that worry that children don't drink enough if you don't give them these sweetened things has been a barrier in some cases in your advocacy project. And have you considered in any way looking at drink for thirst rather than pushing water as part of the message?
I think that mindset goes beyond just beverages. So we've all heard parents who will say, but he won't eat. So therefore, anything is better than nothing. And that this child will starve and waste away and die of dehydration if I don't give him A, B, or C. So it is a mindset that's clearly difficult to work with. And I think that again, in the Loving Care books and in many other places, the idea of the 2 roles of eating and drinking in families. 1, the parent's job is to provide healthy choices. And 2, the child's job is to eat and drink what they need from within those healthy choices. And and reassurance and reassurance and reassurance that children, you don't see them in North America wasting away and dissolving into a puddle of malnutrition. There is malnutrition in Canada, I know that. Nor do they dehydrate if they're left to only choices that are healthy. And, if you think about as well, most families have decreased the amount of fat in the milk that they're drinking. And that's, I've found, a good analogy. When you change from whole milk to even 1% milk, there is an initial taste issue that has to be overcome. But when you get there, going back to whole milk tastes terrible. And it's the same with salt. It's the same with sugar. And it just takes time.
Great presentation, guys. I'm never going to look at a tap the same way again. I wanted to get your opinion about, I'm imagining myself in my office and then wagging the finger, which I do very well at parents. And I wanted to get your feedback on, because it's been shown that essentially it's shaming, and I'm not saying, we see a lot of advantages to your campaign, which involves a lot of other community initiatives, but because it's been shown that if you, with the effect of shaming for any type of change in behavior, that depending on your socioeconomic class, if you're a higher class, I think shaming works, you shame parents into changing behavior. But for less educated, families who are struggling, if the shame actually has been shown that they can have the unintended opposite. Just want to see your comment on it.
So I definitely agree. I think there's not going to be any utility to shaming families, and what I try to do is sort of reframe it in a positive light, really encourage parents to make healthier choices and say, it is really difficult, and I really see that you're trying to make some efforts to have your child be healthy, and here's one suggestion I could make for you is maybe you could try this. And so just trying to frame it in a positive light as opposed to saying you shouldn't do this, just sort of saying here's an option of something healthy you could choose and try to empower them.
Mm-hmm. And also, the whole concept of motivational interviewing, which we're all beginning to learn a little bit more about, and asking them, here's the big picture. What small change do you think you can make? Where do you think you can take this for the first step? And then success breeds success. So I agree, shaming is not where we go. Finger down.
Thanks very much for an entertaining round. Drink water. I was wondering if any of the water could be caffeinated.